Are you confused about your exam preparation? Are you confused about which best sources you should follow for your exams, for your FMG or any kind of competitive exams? You are in the right place. Just watch the video till the end. Hi, I am Dr. Sourav, a foreign medical graduate currently at Government Medical College doing my CRMI. Today I will tell you what's the best sources to prepare any kind of competitive exams after your medical schools. It could be FMG exam, it could be your NEET PG or any competitive exam on your PG level. Now, this video will be for all kind of students who are in the final year or who are just started their medical schools and thinking about that we have FMG exams, or they are planning about their next PG or aims, any kind of competitive exam. In this video, I will try to give you detailed information that any kind of students who are in your final year or who are in the first or second year, it will be very easier for them to make a decision. Now, for any kind of examinations, the best sources is about your own medical books. If you are in your final year, it is very tough to follow those books because you have a limited time. In that time, you could not finish all the books. But if you are a starter in your medical schools, like you are in the first year or second year, you have enough time. You can go with the books, right? So first, I will tell you the recommended books that you should follow for any kind of competitive exams. In the preclinical subjects, you have anatomy, physiology, biochemistry, PSM, microbiology, pathology, pharmacology, those subjects. So what's the best authors' books for each subjects? For anatomy, you should go for the B.D. Chaurasia. For the atlas, you should go for F. Natter Atlas. And for the histology and embryology, the books by Inderbir Singh is literally good. For the physiology, the Bible is Guyton and Hall. If you think that this book is little bigger for you or little tough to understand, then the book by A.K. Jain or Simbalingam, those authors are literally great. For the biochemistry, I will recommend you U. Satyanarayana and Chakrabarti. Please try these books and you will fall in love with the biochemistry. For the pathology, you have the Bible. This is Robbins and Cottrell's. Read from the first page to last page because you should not skip these books. This is the Bible in the pathology. So please go for these books. For microbiology, the book by Anant Narayan is great, and microbiology also with Panikar's Parasitology. This is great book. For pharmacology, you all know that K.D. Tripathi is Bible for that. For preventive and social medicine or community medicine, for this book, Park is literally great, but these books came with very large volume. If you feel that this book is literally bigger for you, I will recommend go for PSM by Vivek Jain. This is literally great book, and you will cover your all PSM. This is a literally great book. For FMT or forensic medicines, the good book is Narayana Reddy. Let's come to the clinical subjects. The clinical subjects comes like medicine with psychiatry, surgery with anesthesia, radiology, ophthalmology, ENT, then have your obs and gynae, like those subjects. So let's start one by one. In medicine, you should go for the division because Harrison is a little bigger, so my recommendation will be go for the division. And for the diagnosis purpose, the best book is MacLeod's Clinical Examination. For psychology, it's Kaplan's and Staddock's concise textbook by Benjamin Staddock. The name is a little bigger, but this book is quite good. For surgery, you know the Bible is Bailey and Love. There are no replaces. For surgery, Bailey and Love. Go for it. For the anesthesia, the good book is by Chandrasekhar R. Lakshmi. I have followed it, and this book is literally great. For the radiology, there are a lot of books, but I think the books that is much more informative is Radiotherapy by David Shotton. For dermatology, you know that the books by Nina Khanna, it's literally great book. For ophthalmology, go for the A.K. Khurana. For obs and gynae, go for D.C. Datta. This is a Bible for obs and gynae. For the pediatrics, the best book is by Guy's. All medical students, they follow this book, and this is literally a good book for pediatrics. For ENT, P.L. Dhingra and Shruti Dhingra. We call it like books by Dhingra. This book is literally great. Now, if you're in your first year, you can go for all these books because you have time, right? But if you are in your third year or fourth year, it means you have started your clinical subjects. My recommendation will be, don't start the preclinical books again, because I think when you are in the clinical subjects, you need a lot of times to cover the clinical subject. So if you are in your fourth year already, your clinical subject started, then choose those clinical books, medicine, surgery, and study all the books. Who are in the third or fourth year, they start with the clinical books. My recommendation will be, don't go for the preclinical books because time is very limited. When you are in clinical subjects, it takes a lot of times to cover all these books, because study is not only the important, you also need to revise it. Now you have studied a very big large volume book but you could not revise it, it means you will forget everything. So do a smart work. If you are in a third or fourth year, then started to follow those recommended books, clinical books like medicine, surgery, because in your medical college you are studying those subjects. These are your current subjects. So start to follow those subjects with recommended books. The what to do about your preclinical subject? My recommendation will be First Aid USABLE Step 1. This is the books that contain all the preclinical subjects, very concise and very informative. Now, if you have that potential, if you have that speed that yes, I can finish one subject very fast, then you can start any preclinical book. But always keep in your mind that you have enough time to complete that book and at least revise it once. Otherwise, whatever you have studied, you will forget, right? Now, what about for those students who are in their final year? They don't have enough time to complete any of the books because they are just in the final year. They have 8 months to maximum 1 year for their preparation to any kind of exam. For that, my recommendation will be, go for the teaching platforms, go for the notes. Now in India, we have a lot of renowned teaching platforms like Prebladers, Marrow, Damsteli, Unacademy, Dr. Bhatia Notes, a lot of. Now you can take the subscriptions, or you can download the PDFs, or you can buy just the notes and you can study by yourself, so that you need less time to finish all the subjects, because you have less time or you have more time. At the end of the day, you have to finish all the subjects to clear the exam. Now who have much more time, who planned much more earlier, he will get enough time for their preparation. So recommended books are for them who have enough time. But you are in the final year, or maybe you have 6 months left for your exam, so you don't have enough time to go for all these books. So you need those particular notes, those informative notes that are made for the exam, right? So this is the sources, you should go for it. Which teaching platform you should choose or which notes you should buy, it's up to you. Why? Because it depends on your potential, your speed. It depends how fast you can complete each subject, right? If you think that you can complete the subject, you have the base in each subject in your medical college, you have studied little bit and you have that base, you know something, you just need to connect all the subjects again or to remind again, it means your potential is good. You can take marrow, because marrow is much more informative, but the syllabus is literally fast. It takes much more time to finish. If your potential is literally good and you can finish the subject very fast, then it's better to go for the marrow. But if you think that no, I also have to gain some base, because I'm not that much confident, I have to study from my zero level, then I will tell you that go for the pre-bladders or any other notes whose notes are little bit concise and little bit easier compared to marrow. So this is the scenery. Now write in the comment section in which year you are in your medical college, and if you want to watch that video, that how I prepare for my FMG or which sources I have followed, also the link will be in the description below. You can go to my channel and you can watch that video too. Now you have to keep in your mind that you have to study. You are going to be a doctor, so you need to study, you need to gain a lot of knowledge. There have no shortcuts, right? In a shortcut way, maybe you could pass the exam, but you could not treat a patient. So study well, be a good doctor, because one day someone's life will be in your hand. Patient will lie in front of you in the bed, and you have the seizures on your hand. Only you can give them life. So study well, improve your knowledge, and be a good doctor. Thank you.